Now we'll discuss two things that usually would affect the intestines. That's like disease conditions that could actually affect the intestines. So the first one is what? Intestinal mucosal atrophy. When you say something is atrophying, basically it's like a medical word of trying to say the thing is actually wearing away. Alright, then intestinal metaplasia. I tell you, metaplasia is more of like an epithelium that used to be there is being replaced with another epithelium. Okay, so let's discuss them. They are just terminologies, not really terminologies, also associated with different disease conditions. So for the intestinal mucosa, well, it must not only be intestine. We just say mucosal atrophy because it could be intestines, could be stomach. All right. So most of the times we refer to the stomach even. So maybe there's loss or thinning of the gastric mucosa, especially the glandular epithelium. So it could be associated with what? Helicobacter pylori infections. Then sometimes it could also be associated with autoimmune issues, where the body's immune system is attacking the body's own cells. Then sometimes long-standing chronic gastritis. So for morphology, there's thinning of gastric folds, loss of parietal and chief cells replaced by mucus secreting cells. Okay, also reduced acid and intrinsic factor secretion. So intestinal metaplasia now, this one is replacement of the what? Gastric epithelium by what? Intestinal type epithelium. Alright, so I think when they actually say gastric here, they are referring to both the intestines and the stomach. You understand? So there's a replacement of one epithelium by another one. So types, we have the incomplete, where the gastric mucosa is replaced by absorptive cells, goblet cells, and pernicious cells. Then, okay, that's a complete. While we have the incomplete, where cells resembling colonic what epithelium with regular mucin production. So morphology, the experience of goblet cells, columnar absorptive cells with brush border. Sometimes you can see pernicious cells with what? Eosinophilic granules, right? So causes, that one is also associated with what? Helicobacter pylori infections. Then stomach inflammation that's actually gone on for a very long time. Then the type of food you eat, if you smoke, if you take alcohol. Okay, so both of them shows that there's a disease condition and it's progressing. If it does not receive better attention, it will actually progress to become cancer. Okay, so once you see them, there's an increased risk of what? Gastric adenocarcinoma.